Degenerative disc disease is a source of chronic back pain in a lot of patients. This particular patient has had chronic back pain for several years, which has not responded to non-operative treatment modalities, and we have offered him an L5 S1 fusion. The L5 S1 transsacral fusion is a percutaneous technique for fusing the L5 S1 space. It's a more recent technique, and it's one of the procedures that's at the forefront of spinal fusion surgery. For this technique in particular, we would study their bony anatomy with X-rays and CAT scans and MRI to make sure their anatomy was amenable to this particular technique. The traditional technique would be to go in the front using a vascular surgeon through a fairly large incision and exposing blood vessels and bowels and other structures which would need to be moved out of the way in order to get to the spine. Using this technique, we can come from underneath next to the tailbone through a very small incision, typically around 3 centimeters long. And we're able to utilize the space between the rectum and the sacrum and place a screw called a transsacral screw to do the fusion. Any minimally invasive procedure is attractive to a patient for the following reasons. There's less scarring, there are smaller incisions, the hospital stay is shorter, there's less bleeding, and there's less pain post-operatively, and there's a quicker return to recovery and a quicker return to their normal activities of daily living. So I've always found in offering patient a choice between minimally invasive technique and traditional techniques, 9.5 times out of 10 they'll always choose the minimally invasive technique. One of the most gratifying things about what I do is to see the change in the patient's lives and to see them even from the very first couple of hours after surgery, and certainly the next morning when they're up and walking around and their leg pain or buttock pain or back pain is gone or significantly better, and they're very thankful and grateful. And it's one of the more gratifying things about my job.